My mission is to teach enough of you to say, I should be asking more of my dentist. And really, research shows that 60 to 80% of chronic disease starts here. Dentists have a responsibility. I'd been taught that if I said that it could affect anybody's health, I would actually lose my license. In today's modern medicine, if we get a headache, we can take an ibuprofen because the headache's the problem. But that's not true. The headache is your cells trying to tell you that something's going on. There are so many signs and symptoms in the mouth. Worn off teeth, you're not breathing. Gum-lined cavities, your gut's not working. What do your cells need to stay well? We're not made to be sick. We're made to be well. Our bodies know how to do it. They come back and they'll say the craziest things, like a week after I got that root canal tooth out, my eczema was gone. Or my cholesterol dropped by 90 points. I mean, those are the cool things when we see a huge impact.
Hi, everyone. Welcome to the show. If you're someone who deeply cares about your health, the show is for you. I am talking to Dr. Michelle Jorgensen. This is an important conversation because it's all about your mouth, your teeth, and the health of your entire body. So Dr. Jorgensen is a traditionally trained dentist, and she ended up having her own health issues and she couldn't figure it out. So it led her down a series of rabbit holes to try to find the answer. She was having brain fog and numbing in her hands. She finally talked to somebody and they said, it sounds almost like you have mercury poisoning. And she said, yeah, but I don't have any mercury fillings. And he said, no, but you take them out. And this led her down a path of an intense new practice that she's incorporated not only for herself to protect her patients, for younger patients to be able to avoid, certain things that are really customary, like, oh, we just get our tonsils out. We just get our wisdom teeth out. But what if we could plan ahead and say, oh, the jaw's, a little narrow. We could open that up. So if you're somebody who is undiagnosed with something, or you've had a root canal or fillings or just things that you're not sure about, it impacts everything: chronic inflammation, hormones, and so many other parts of our health. So I really appreciated this conversation because she makes it not only clear and concise, actionable, so it doesn't feel daunting, and shares like real tidbits that we can ask our dentist for, request tests, or get scans that maybe are not available at our dentist to really get a whole look at the picture in our mouth and how that could be possibly impacting our health. And she has a new book coming out tomorrow called Living Well. Let's go. Dr. Michelle Jorgensen, welcome to my home.
Thank you so much. It's so beautiful here.
Well, nature is really beautiful.
Actually, I agree with you.
Yeah. So in getting ready for this, you sort of, in medicine and in your case in dentistry, it's like, oh, you were a normal dentist. Mm-hmm. And then something happened and it sort of changed the trajectory, not only of your own practices as a person, but in what you're offering as a dentist.
Yes.
So maybe you can share sort of maybe the moment. I mean, it really took getting unwell, being sick, for you to dive into where you are now.
Exactly. Yeah. It was certainly not an intentional path. It was nowhere that I thought I was going to go or planned to go. And really, I was traditionally trained. So my father's a dentist. My grandfather was an internist. This was just the way our family was trained. In fact, they would joke and call chiropractors quackopractors, growing up. So there really wasn't a lot of room for anything alternative in my world. But at about 10 years into practicing dentistry, I got really sick and I didn't know what it was. And so when you get sick, you just start trying everything and anything that will help. And I went to doctor after doctor after doctor, the kind of doctors that I knew to go to, mm-hmm. and no answers. Nobody could tell me what it was. And so
what were your symptoms?
Big time gut problems. I just literally, sometimes I couldn't even drink water without pain. It would just hurt all the time. And so you start changing your food, right? We threw away all of our food. My kids were like, okay, Mom, what are we eating now? Our cupboards are empty because you threw away all the crap and you start just bringing in all the good food, and it helped, but not entirely. My memory, I've always had a good memory, and I couldn't complete sentences. I couldn't remember a patient's name from room to room. And then the big one was numbness. My hands were so numb and painfully numb. Like it hurt so bad when I would sleep or when I blow dry my hair or do anything with my hands, especially hold my instruments. So I actually had my practice for sale, and we didn't know what we were going to do. I was in my mid-30s, 4 young kids. So my husband worked for the practice as well. This literally was everything. This was our entire livelihood. And didn't know what I was going to do. And eventually, talking with anybody and everybody, I talked with a holistic dentist. I didn't even know what that was. And
but what is that? Like, how did you come upon a holistic dentist?
Yeah, I was thinking, well, I've been learning a lot about nutrition now, trying to improve my own health. Maybe I could talk about nutrition and maybe I could bring that into my practice. And instead of doing the dentistry, I could just teach people how to eat right. And so I was talking to other dentists who had done something similar. And as I was talking to one of these dentists, he said, have you ever looked into mercury poisoning? This sounds so much like some symptoms that I was experiencing too. And I said, well, no, I don't have any fillings. I knew that silver fillings had mercury in them, but I don't have any of them. And so I said, well, I don't have any fillings. And, I've been taught that they're completely safe. And
right, because it's like inert when it's combined with the other chemicals. It's sort of housed.
Yeah, that it just keeps them all, locked up like this. And I'd been taught that. And I'd been taught that if I said that it could affect anybody's health, I would actually lose my license. So that's the only thing I knew.
Is that for real?
That's for real. Yep. That we would lose their license because there was a dentist, his name's Hal Huggins. He was in Colorado and he lost his license for telling anybody that mercury could affect their health. Mercury and fillings could affect their health. So they said, so don't even go there because you'll lose your license too. So that's all I knew. And he said, well, maybe it would just be worth testing anyway. Where else are you going to go? What else are you going to do? Yeah. So I got tested. That's what it was. Mercury toxicity off the charts. And it wasn't because I had fillings.
You were removing
I was
fillings.
drilling them out because I was a cosmetic dentist. And so people said, I don't like the way these fillings look. I want them out of my mouth. And so I was drilling them out. And when you're doing that, the dentist's head is right above the patient's head. So mercury turns into vapors, comes up, literally killing me. So that was the point when I said, what? I've never been told this. If anybody had even said this could potentially be dangerous to the practitioner as well as the patient. Mm. And there's a lot of people that talk about dentistry has a high rate of suicide. Now I push back and say, it's because all of our brains are fried.
Yeah, it's a great point.
Could this be a problem? Because there's not a lot of other reason for it other than just our brains aren't working anymore. So it was mercury off the charts. And I had to really then go to that threshold and say, what else do I not know inside of my own profession that's affecting me, that's affecting my patients? What else do I not know that I haven't been told that I now need to go find out about? And really, honestly, my patients led me down this pathway because they would say, my doctor's been talking about this. Maybe they'd want to talk to you too. And then a doctor would say, well, what do you know about fluoride? I'd say, oh, it's great. It strengthens teeth. And they're like, what do you really know about fluoride? Or they would say, what do you know about root canals? I've heard some questionable things. I'm like, I don't know. I do them every day. Maybe you got to look a little bit more into it. And that was really where that just path changed entirely.
So I find it really interesting. A lot of times when people are really smart, especially in an academic way, and they use academia to propel themselves forward, and they sort of know something, at times they are also the hardest people to change their mind because it's a slippery slope. I mean, I think we all feel that way. Like, wait, what do you mean this thing I've been doing it and the way I've been doing it, it's actually wrong. I felt this way as a parent before, where you sort of have to look at it and you have a choice to make so it's interesting because maybe you had to be the patient to somehow really force that, like, okay, I'm going to look at it. So how do you start to take away for yourself in the health part? What were some of the first steps to kind of see if you could, peel the onion a little bit and start to improve and support your health?
Yeah. So I had to first figure out, was there a way to keep doing my job and not getting more mercury in? Because the doctors, once we finally found it, they said, well, you can't keep putting it in and get out at the same time.
Yeah, it's like even Steve, nothing, no gain.
Yeah, you're never going to get better. And so I actually found an organization that had protocol for removing mercury fillings safely. I didn't even know they existed. So most dentists don't. Found this organization, started doing all of these steps. So that was the first step. And then, like I said, a doctor would say, have you looked into ozone? And so then I would look into ozone. And thankfully, I'm a question asker. That's always been my nature, where if I don't know the answer, I'm going to go find the answer. And I'm going to keep digging until I do. But you're exactly right that sometimes it's hard to kill those sacred cows, those things that you have been ingrained with and doing. Like I said, I had been doing root canals. I had been prescribing fluoride. I had placed silver fillings early in my career. I had done all of these things. And it's kind of a hard pill to swallow sometimes to go, maybe I'm personally wrong here.
Yeah.
It doesn't feel good and it's not easy to do. And I think that that's why it's so hard sometimes to change some of these paradigms, because it's swallowing your pride and saying, well, I guess I didn't know. There's another way now, and it's probably something I'm going to have to look into.
Yeah, I think it's knowing that whatever your intention was good with all the information that they had at that moment.
Yep.
And it's interesting how that not wanting to deal with that feeling of feeling bad keeps us sometimes from making the change versus saying, I did the best I could with what I knew, and now I'll course correct.
Yep.
I think that we spend a life doing that.
We do. Yeah. I'll always remember a patient. It was probably maybe 5 years into when I'd really started changing, but I still had a bit of a foot in both worlds, at the same time, because this was a slow evolution through practice. And so I had patients who had been seeing me for years and years. And I saw this woman, I'll always remember her, and she had 3 root canal teeth that were badly infected down at the bottom. And I looked at them and I said, oh my goodness, I'm so glad we found these. And then I looked at the chart. I was the one who'd done the root canals. Mm-hmm. And I just went, oh, wow. And I remember talking to a friend and she said, but you got 10 years out of those teeth. She got 10 years out of those teeth. You did the best that you could, but now you know better. And now you're going to continue to do the best that you can for her. Yeah. Which is a different thing than it was 10 years ago. And that made me feel a little bit better, but still I can see why these things are so hard to change inside of the profession itself. It's hard to say we didn't know and we didn't do everything we could have at that point.
You mentioned ozone. I used to go to my dentist because sometimes I get cold sores on my lips. I get them less now because I can handle it with lysine and things like that. But he would put the ozone wand over even a cold sore for me. And then, a lot of people don't know that you guys will use ozone to really, I don't want to say disinfect the area, but kill any viruses down deep inside. Yep. And there's so many incredible new things. And I have to think that a lot of people listening to this, speaking of root canal, because that sort of seems like teeth being pulled, root canal, these seem like kind of not the worst things that happen in dentistry, but sort of the bigger stuff. Yeah. So I think a lot of people have had root canal. I've certainly had a root canal, and I had to get on a plane the next day, and it was totally fine. But is it too late for us who've had root canal?
Yes.
You know what I mean? Because, and we're gonna get into the scans and stuff. But so if someone's listening to this and they go, "Hey, I've had root canals. Maybe you've lived long enough on the planet." I find like they say that the back teeth technically only really, for a lot of people, live like 35, 40 years. Some of them start to break or crumble in based on, whatever, genetics, lifestyle, things like that. Yeah. So I think a lot of people have had root canal. Mm-hmm. What do you say to them to even kind of open that can of worms up?
Yeah. Well, it's interesting because as I've gone down this pathway, obviously I'm a dentist, so I think dentistry is cool. But I'm learning it's actually more than just dentists think it's cool. That there's research showing that 60 to 80% of chronic disease is related to your mouth in some way. And we can talk about all these connections. There's so many connections that are huge. And I see people from all over the world now that come to me that aren't well. And we find answers in their mouth oftentimes. So what I say is, if you have chronic disease, if you have symptoms you're struggling with that you've been working on, but you can't quite get over that hurdle, go look at your mouth, because it might be that for a while that root canal was okay, but then something changed in your body. And now, because root canal honestly is a low-grade chronic inflammatory and potentially infectious thing in the body all the time. So maybe your body can handle it for a while because there's not any other stressors. There's nothing else going on. But then something may have changed, and now your immune system cannot deal with that and what else life is bringing. And so it's not worth keeping that chronic burden in the body anymore. Your body can't deal with all of it. So now it's time to get it out, and we can replace it. Absolutely. So
it's a redo.
It's a redo.
You can get a redo.
Yep. We'll take the tooth out and replace the tooth.
Is there a process of sort of leaving it open for a bit and letting certain things, if there's abscesses underneath or things like that, heal up and then go in and do the procedure? Or is it like, it's just one for one, in and out?
Depends a little bit on the tooth and the situation, how much infection has been there, those kinds of things. But I typically like to leave it in long enough that the bone is strong enough to put an implant into. So we do dental implants. We do ceramic dental implants, because a lot of people push back and say, well, I don't want metal in my body. I say, well, you don't have to. We can do top to bottom ceramic, no metal at all. But the bone needs to be strong enough to actually integrate to that dental implant to be able to have a good replacement. I have a dental implant right here. I tell people all the time.
Did you fall down a stair or something?
I was born without that tooth.
No, come on.
Nope. Yep.
Must have drove your dad nuts.
Exactly. And my younger brother, had an extra one. So we said I was just floating around for a while until he came along. So yeah, I was born without it. But I always tell people all the time, I wouldn't even know I had it, except I have to point it out to people, patients all the time, like, this is an implant. Can you tell? It looks really good,
Yeah,
So it can be replaced, no problem. It's like a sliver. When the sliver's out, the body does a real great job of healing pretty darn quickly. Yeah. So get the sliver out, get the problem out, and the body does its job. That's honestly what my new book's all about, is all about how our cells know what to do if we simply provide them with the things they need to do the job itself. So your body will heal it as long as you get the thing out that's causing the problem.
Was your dad alive when you were going through this in your 30s?
He was practicing with me.
How'd that go?
It was very interesting because he was not a believer. In fact, it was more of a little bit of a making fun of some of these things, making fun of it. Oh, I can't believe they would say that about fluoride. But it was because he was so steeped in all of these long-standing beliefs and traditions. So I look at it now and I see where he was coming from.
Yeah, and he never suffered somehow, right?
He never suffered.
His system wasn't as sensitive or whatever.
And I've learned it's very genetic based. There's a genetic variant called MTHFR. Probably a lot of people have heard of this, where you don't process things the same way. Well, I'm double. I got one from my dad, one from my mom. So I don't process mercury the same way. And here's another thing. Mercury actually detoxes through moms to their first child. About 80% of the mercury in the mom's body, if they have mercury fillings in their mouth or mercury from whatever other source, it will detox into the first child.
And you're the oldest.
Guess what number I am? Yep. And my mom's mouth was full of mercury fillings. So I think I already had a mercury burden before I started working as a dentist. So it just accumulated and doubled up on me, where he wasn't the first child for his mother. So he didn't have that initial burden, and he didn't have that genetic variant that it didn't allow him to process things very well. So this is why really there's no one size fits all thing for anybody's body, because all of our bodies are different and we're going to handle things differently. But there are some pretty good frameworks that we can work inside of, for sure.
Did you, because I would imagine the machine that you have to put on someone when you're taking out their fillings, it probably, big vacuums and kind of all of these things. So you put that into your practice, in the practice you shared with your dad?
Yep.
And did he ever adopt those practices, or he just did it old school? Well,
when I put the practice for sale, he saw the writing on the wall and he said, well, I guess if you're going to be selling, because he was working for me at the time, if I'm going to be selling, I might as well go find another job somewhere else. So he actually left the practice at that juncture. He left. Everything just came crashing down all at the same time. And then I got the diagnosis, finally figured out how to move forward, and just slowly limped our way forward. So he was actually never in the practice. But it's interesting because now he's an enormous support for me. And he sees what I'm doing and he says, yeah, I actually think I had, in fact, just this weekend, he heard me speak somewhere and he said, I had some of those symptoms too.
Yes. It's amazing what we push aside. And then when somebody goes, I feel like this, and you think to yourself, oh, you know what? Maybe I've experienced a little bit of that.
Yep. Maybe I had some of that. And you just blame it on other things.
Yeah. Or
especially
I'm tired.
Like gut problems, or, you just think, oh, it's just this or it's just that. And we're really good at accommodating for what we have in our lives. If we have a sore ankle, we just walk a little differently, rather than really addressing what's causing the problem.
I think it's scary I've been in the space of talking about some form of wellness for a really long time. And I'll tell you the truth. Every time I get my blood work done, I sort of don't really want to deal with it.
Exactly.
I'm just like, I feel good. Good enough.
Fine.
Good enough.
Yeah.
And it's just an interesting thing. And there's other people who, they want to dig in there and, sort of get all up in it. And for me, I'm like, yeah, I'm good. So I think when we talk about the mercury, you really drill down on how your mouth can reflect, the whole system. Yeah. And I know it's impossible to sort of go through all of them, but maybe you could just share, if somebody comes to see you, some really common things that when you see it in the mouth, what does it look like? And a lot of times, what is it connected to?
Yep. So it's interesting because the mouth actually, I like to think of it almost like a dashboard of the body, and we can see it. Where if you want to find out what's going on inside, you have to do a blood test. or you have to do an x-ray, or you have to do something, but we can actually see in the mouth. So what are some of the things that I see? If I see worn front teeth, so you may have seen people like this where their front bottom teeth are just kind of flattened out.
Yeah.
You may have noticed that before. You can kind of see the inside layer of the tooth a little bit through there, and you wonder what's going on up here. What that is from is the body is desperate for oxygen. Obviously, we can't survive if we can't breathe. And so when you lay down at nighttime, the tissue in the mouth, in the throat, the tongue, the soft palate, all of that, if it falls backward with gravity, and if there's not enough space behind there, the body knows one thing it can do is bring the bottom jaw forward like this. That's the only way you can wear off front teeth like that, because nobody chews like that, right?
Yeah.
You don't chew like that. So if you've got worn bottom front teeth, this is 100% a sign that you have what's called sleep obstruction, airway obstruction. Now, this affects probably 80% of the population. I mean, how many people do you know that say, I can't go to sleep, I feel tired when I wake up, I wake up in the middle of the night and I can't go back to sleep? So many people struggle with sleeping issues. And so we try all of these sleep hacks and all of these different things to do, when at the root of all of it, it's you don't get enough air. So your body's struggling. So you squeeze your teeth. People wake up kind of sore and tired in the morning like this, and you can't figure out why, because you're squeezing at night to tighten up all the muscles to get more air. You're wearing out your bottom front teeth. All of these are signs. You do things like this. You put your hand on your chin. Why? Because it brings your bottom jaw forward when you're focusing.
Trying to get air.
And needing more air when you're focusing. Yep, absolutely. You bite your fingernails. Why? It brings your jaw forward and gives you more air. So many really interesting things, again, that the body accommodates to just get more oxygen. So that's a big one. That's one of my big threes.
So if they come and see you and this is happening, what do
we do, right?
Yeah, what are they doing? Because I always love, like, people settle for, and I'm not criticizing people, but I do find it curious that they go to sleep with these huge machines on, these CPAP machines. And I'm like, wait, that's
as good as it gets.
That's what you're going to do?
Yeah. I joke with them. I say, listen, you probably picked your spouse. Did you also pick this machine? Because you sleep with it every night too.
I mean, it's just,
really?
And then I think about, like, two spouses, they're both going to sleep with one, or you look, I mean, it just seems
People
like,
do it.
Hey, you guys, maybe we need to back into what the root cause of this is. Not like, oh, well, I guess I'm wearing this.
Yeah. Yep.
So
what do you do?
Yeah.
Right. Exactly. So the question is it a structural problem? And it usually is. So you talked about a scan, and we use the scan for so many things, but it's called a cone beam CT scan, abbreviated CBCT. That scan can show me your airway. It can show me tissue. It can show me how much room there is to breathe. And the tube you breathe through isn't the problem. So when they're giving a CPAP, it's not that, you can't get air into the tube. It's what else is also pushing its way into the tube. This often shows up with developmental issues in our mouths. So many of us had braces or crooked teeth or had to have wisdom teeth out. All of those are signs. And how many kids now today have crooked teeth, get braces, get their wisdom teeth out? These are all signs that the jaw did not grow adequately. There's inadequate jaw growth. Why? This all goes back to nutrition. The first bone affected by malnutrition is the top jaw. So if we are not if we don't get enough nutrients, what do you think? Well, we have a lot of food. We have a lot of food, but the food doesn't have the same amount of nutrition in it as it once did. So we're missing a lot of the vitamins and minerals that are essential for bone growth. So the jawbone grows small, the top jaw grows small, which traps the bottom jaw that has to fit inside of the top jaw. So everything is small. So I liken this to a very tiny garage with a big extended cab pickup truck. So where does the rest of the pickup truck have to go? Back into the driveway. That's the airway. So now the tongue falls back, the tissue in the back of the throat falls back, everything falls backward. There's no room for air to pass. So then you strap a CPAP on. You're forcing air down a blocked driveway. Does that make sense?
Yeah.
So many people say that thing just blows off my face. Why? Yeah. Because you're forcing it through a cocktail straw here. Everything's squished back and you can't get the air through. So the key is make room in the front of the airway. So we actually expand palates. We do this in kiddos. We intercept growth in kids so that this doesn't happen. But we also can do it in adults. We can actually expand mouths out and retrain the tongue to come forward and out of the airway. I have so many stories. I mean, I can tell you story after story. I remember this one gentleman, he came with his wife and he cried through almost the entire appointment, which men don't do that. right?
Yeah.
Men typically don't do that. And he was a big old guy. He was a big, burly, manly man. And he was a truck driver. And he said, I can't make it 2 hours on the road before I have to stop and pull over and take a nap. And I'm afraid I'm going to fall asleep at the wheel and I'm going to kill somebody.
Yeah.
He said, I don't sleep. I can't breathe. How can I get better? And that is the kind of story that we say, we absolutely can help you.
What kind of rig is it? Is it retainers from the inside? Is it a bracing situation? Is it something from the palate that opens it up? Or is it kind of a combination depending on the person?
It depends on how much space we need to gain. Usually we can do this with clear aligner. So it's like Invisalign.
Yeah.
So it's really simple. And it's just something you wear that helps to make more space. It's really undoing our environmental issues that we all had during growth and development. So this is why I love to talk about it too, because we all have kids and grandkids. And guess what we're doing in my home for my little grandbaby that her baby teeth are even crooked. We are going to be expanding because kiddos, the problems there show up as ADHD, bedwetting, focus problems, growth deficiencies all happen when they are not getting enough air at nighttime. And we just call it something and give them a pill rather than saying, oh, maybe you're not breathing. Let's fix that. So if your kid has really crooked teeth, somebody who's listening here, crooked teeth, you're looking at they cannot breathe. If they have dark circles under their eyes, they cannot breathe. They cannot be expected to focus in school and be their best.
This podcast has been brought to you by Troscriptions. They have a great offer for you today, and I've personally been taking the product as well as some members of my family for a few months now. It all started, I started doing some homework, then I got Dr. Scott Schur on the podcast to learn more about methylene blue. I encourage you to listen to any of his interviews. It doesn't have to be the one I did, to learn about a new way that's actually been around for a while to optimize your health, and that's with methylene blue. But the important thing is you want to get it the highest quality possible. So Troscriptions really can guarantee that. They also have an array of different types of products. They have a calm, they have an immune boosting one, they even have one with nicotine. And the other caveat, and you'll hear this with Dr. Schur, is once you take methylene blue, it's like get outside, get in the sunlight, or get in the red bed. So there is a specific way to utilize this as a tool to support you. And it's important to do your own homework, but it's also important to get best in class. And that's what Troscriptions is. They have a great offer. All you have to do is go to troscriptions.com, troscriptions.com, and use the code Gabby, Gabby, for 10% off your entire order. That's troscriptions.com. And don't forget to use the code Gabby. I have my youngest daughter. My husband was, loves like what is it Weston Price? So we used to look at books of Weston Price and how a lot of the indigenous cultures, the jaws are extraordinary, beautiful, wide, perfect, straight teeth, just crazy good. And Patrick McCune, he wrote The Oxygen Advantage.
Yep.
He's British or Irish actually, but he used to joke about how he is the typical, like squished in jaw. And when he started learning about the breathing, you can see his face even opened up.
Change. Yep.
And so my youngest daughter, though, was tongue-tied. And luckily I had learned about it. And I couldn't tell during nursing because she didn't have an issue latching on. But when she was about 3 or maybe a little older, I started to notice a tooth that was coming from up high and there wasn't going to be room. So I said to Laird, oh, something's up. So they realized she was tongue-tied. And she was quite a bit older, maybe by this time, like 5 or 6,
wow.
and they lasered it underneath, bang, and her jaw opened up, to your point. So I think for parents, those would be the most helpful cues. It's so interesting because I think if you think about it, okay, sitting, not getting outside, not being in sunlight, eating processed foods, all of these things, because when you look at when Weston Price goes to these places where people were living really naturally, the mouth and the jaw were extraordinary.
Yep. And that's so funny that you bring him up because I'm actually just speaking to a production company right now to go retrace Weston Price's footsteps.
Are you serious?
Yep.
What a treat.
And to go back to these societies and say, what's happened now?
Yeah.
What's happened in the last 85 years since he was there? what's happened now with nutrition and how has it affected growth and development? How has it affected nutrition? How has it affected health, fertility? He was looking at all of those things in relation to nutrition levels. So those are the things that I see as well. And, you asked about what other things do we notice? Cavities are interesting because everybody thinks it's because you didn't brush your teeth, because that's what your mom told you, right? Because that's what her mom told her. Well, cavities can come from two things. If you don't brush your teeth, sure. Bacteria are going to gum up your teeth. They're going to eat sugar and they're going to create a cavity. Absolutely. But there's another way too. And this is Dr. Weston Price's findings. He found that you can literally be cavity resistant, like create an umbrella almost over your mouth that you will not get a cavity. And I have seen this in real life. My brother growing up, I've seen this in multiple patients, but my brother growing up, I swear he didn't brush his teeth for like 5 years. He had to like start caring about girls.
He had extra.
Yeah, exactly. He didn't have a cavity ever. He never had a cavity. So what was different? Because then I'll see people all the time. I remember this young teenage girl, her mom brought her in and said that she was in college. And she said she went to the dentist in her college town and he told her she had 16 cavities. And I know he's just trying to get money. She's just saying, can you give me a second opinion? So I looked through everything. I said, well, she doesn't have 16 cavities. She actually has 17. Mom about died. She said, what is going on? This is all about nutrition. So in today's world, first of all, our food doesn't have as many nutrients as it used to.
Right, our soil.
Which means the food in us. So the other issue is our guts just aren't as effective as they used to be. So I have a really easy test that everybody always likes. So I'll share it with you to see if the gut is actually strong enough to break apart the food to get the nutrients you need. Because I can look at a mouth, and if you're getting cavities, I can just look at an x-ray and say, you've always had cavities, haven't you? And they're like, yeah, how do you know that? Well, I can see because you have like a filling in every tooth. It makes sense. Yeah, I know. Okay, I bet you anything your gut isn't working properly. What? Let's get into this. So what you do at home, you take a 1/4 teaspoon of baking soda, 1/2 cup of water. You've probably heard this one. You drink it, and you see how long it takes you to burp. Why? Because the baking soda should interact with stomach acid. And it creates a chemical reaction, which means a burp. You should be burping in 2 to 3 minutes. If you're not burping in 2 to 3 minutes, you do not have adequate stomach acid to ionize minerals properly. So you may be eating the most delicious, amazing food on the planet, but you're still not getting it in through the stomach and into your cells. So this is what I see in a mouth, especially if I see cavities along the gum line at all. Immediately, that's a nutrition cavity. So if I see a cavity along the gum line on somebody's tooth, I say, you have a nutrition deficiency. You need to supplement. You need to get working on your gut health. This is the things you need to see. So these are the things I look at. When I see worn off teeth, you're not breathing. When I see gum line cavities, or even you're getting cavities all the time, your gut's not working. If I look at gums and they're red and they're bleeding, but yet you've cleaned your teeth, I'm like, this is a circulatory problem. You've got heart issues. You've got brain issues. Like you are on your way to a heart attack and a stroke. So that's what we need to start dealing with. There are so many signs and symptoms in the mouth when you just know what you're looking for.
Are there a lot of dentists? There's not a lot of dentists like you around. I mean, it's not that I've been around, but I've been around.
Yes.
And I've heard a few talk about a little bit of this, but not to this extent. Is it growing when you go to school? Is there a way to incorporate this type of training, or you have to sort of take it upon yourself to do it?
You have to take it upon yourself. And I've talked with so many dentists. I train dentists. It's actually my least favorite thing to do because dentists are so entrenched in what they're doing. Do you know what I mean? And it works.
Yeah.
They're busy. They're patching holes. They're mechanics.
Yeah.
You come in with a tooth that's broken and they patch it on up and send you on your way. It takes extra effort to say, why did the tooth break? Why did you get a cavity? Why is it worn out? It's much easier just to cover it over if it's worn, or just to fix the hole if it's a cavity. It's much easier to do that. So here's my mission. My mission is to teach enough of you and enough of all of those who are listening to say, I should be asking something more of my healthcare providers. I should be asking more of my dentist. And really, research shows that 60 to 80% of chronic disease starts here. Yeah. So dentists have a responsibility and an opportunity. So now when you go to the dentist, you can say, hey, will you take that scan thing of my root canal? Because I heard, and all of a sudden they'll go, what did they hear? Oh, okay. All right. Well, let's look real close at that scan then and really see what it shows. Wow, it's infected. I wonder if any other root canals are infected. It starts that questioning process in the profession in general. So instead of teaching dentists, I'm teaching all of you to go ask your dentist. So then the dentist will come and learn.
Yeah.
Because their lives are okay.
Right.
Until your life kind of gets lousy, you don't really seek a lot of change oftentimes.
Is some of this becoming more intuitive to you? Like when a patient sits in your chair and even maybe the way that their energy level is, and the minute they open their mouth, are you sort of getting this shorthand language? And of course, you're going to look in the mouth and do your due diligence, but do you have these hunches much quicker now?
Yeah. Yeah. Just because I've done this a long time and I've worked with so many people, and we've seen so many people's lives get better through doing this that, you look at it and you go, okay, yep, I know what this is. I know what this is. And you just start to put pieces together. And really that's my next step now, is what's next? Once we've discovered these issues, how do you fix things like getting supplies to the cells from food? And how do you, because it's not easy, but it's easy now for me to say, you were nutrient deficient growing up. Your mouth's too small. You can't breathe. Let's widen it out. But now it's the next step to say, why are we nutrient deficient? And how can we fix that in the world that we currently occupy? Because it's different than Dr. Weston Price lived in the 1800s. Yeah.
What's the dentist in England who, he's very controversial, forgive me for not, it just dawned on me, where he really talks about the opening of the jaw. They give him a really hard time over there.
I don't know.
I'll remember it and give it to you. So this is like really a selfish question. I recently noticed kind of a laziness in my S's, where the back tooth, I can feel my back of my jaw touching the top of my jaw sooner. And I go, something's changing in my mouth or my jaw. And I asked my dentist about it. And I said, listen, it's very subtle, but I see it. And is there something I can do? Because does that mean, I know with age and time sort of things fall in, that's what it is.
Sure.
But I was wondering if, because it made me think, maybe I need to open up my lower jaw, to your point.
Absolutely.
Because the S's, it's like you start to enunciate and it hits it sooner.
Do it.
And I thought, something is happening here.
That's really intuitive of you to figure that out, because most people just be like, gosh, why am I slurring to my S's? What's going on here?
Oh, yeah, no. Well, and plus we've been talking about jaws and airways and oxygen and breathing for more than 15 years. Yeah. So it was like, something's going on.
Up.
Yeah.
Well, it makes me wonder too, where did your daughter get the tongue tie from?
Right.
Very potentially you also have a tongue tie.
Yeah.
And interestingly enough, the MTHFR variant I talked about, that is a midline deficiency. So typically if you have a tongue tie, you also have the MTHFR variant. So this is just something, again, people look at and go, oh, okay. So now you're going to process things differently. So now when you go to surgery, you're going to tell the doctor, I don't process anesthesia the same way. Take it slow for me, or those kinds of things. You need more glutathione. Anyway, just things to learn. So I can look at somebody and go, oh yeah, you have a tongue tie. Pretty much always you're going to have a genetic variant because of this, and that's this. But I would bet you have the same thing because your daughter got it from somewhere. Yeah. So
it's definitely not my husband.
Yep. So it might be that you need to do a tongue tie revision also. Okay. As well, which may retrain. And then this is a little bit of an unexplained thing. You can't just clip the tongue and expect that it's going to function right.
Right. You have to stretch it and do all the stuff, right?
Yeah, because muscles have memory. You know this only too well.
Right. You have to do your exercises.
This is your world, it's the muscle world. You know that when you do something 1,000 times, your muscles do it without you even have to tell what to do. Yeah. The same thing goes with your tongue. How many times have you said an S in your life? Yeah. A billion, trillion, whatever. Yeah. So your tongue knows what it's doing now. So if it's struggling a little, it needs to actually be retrained if that tongue has been given some more room to function and flexibility. Yeah. So very likely, again, cone beam CT scan, that's the starting place. You see what's the size of the mouth. Do you need some expansion? Are things falling backward? Where are they?
Yeah, no, because I asked him and he was like, and I thought, that's not what I'm looking for.
You say that when you don't know the answer. I've done that so many times. I'm like, no, it's nothing. It's no big deal. Then
that's fine.
In the back of your head, you think, you just don't know the answer.
Yeah, it's just,
yeah.
So you talk even about hormones. So it's sort of like, this notion of like almost like your fillings could be impacting your hormones. And I know that people, infertility is up for a lot of reasons.
Yep.
Some unpopular to talk about, some, for whatever all the reasons are. I think it's a different time. So if maybe there's somebody who their hormones have been impacted and they haven't gotten to the bottom of it, could it be something in their mouth?
Absolutely. So interestingly enough, if we want to talk about things that aren't commonly talked about, might as well, right?
Yeah.
There's something called the tooth meridians. And what these are is they are along the Chinese acupuncture sites. So this is thousands of years old, right? This is Chinese traditional medicine, which was then documented by Reinhard Voll, who's a German scientist, German MD in, 100 years ago. He documented what they had figured out over centuries of time. And so he knows where all of these points are. And really what they are, the best description I have is they're the off-ramp that, your energy has as it's flowing through the body. They're the way that you can kind of get on that on-ramp and get to energy sites in the body. Now, anytime I talk about energy, people start rolling their eyes like, oh, she's one of those crazy talk people. So I always say,
it.
Exactly. And what I'll always push back with is, okay, if you go to the hospital right now and you get hooked up to a heart monitor and it's going beep, 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 what is it recording? The electricity in your heart. Yeah. What happens when your heart goes beep? You're dead, right? Yeah. There's no more electrical flow. Same thing with the brain monitor. What are they recording? Electrical flow. Yeah. So when I'm talking about electricity and energy, I'm not talking about like woo-woo, whatever. I'm talking literally when the electricity stops flowing in your body, you're dead.
Yeah.
So we all are electrical beings. Everything works by electricity. When your phone's dead, you go plug it in to the wall. Well, how do we plug ourselves in? Where does that energy come from?
Yeah, well, sleep,
food, muscle movement.
Yep.
And the earth itself
grounding,
provides us with electrons. This is where we get electrical flow. Well, the body has a wiring system, top to bottom. So just like the home, your home, if we flip on a switch over there, it's going to turn on certain lights. Same thing goes with your body. You're connected with wiring systems everywhere. So each tooth is actually connected to an organ system. And it's fascinating. This to me fascinates me. Every organ is represented on the feet, the hands, the ears, and the teeth. Isn't that interesting?
Yeah.
Because
I didn't know about the teeth.
Yeah, you think about your feet. How much pressure do you put on your feet? You're recharging every organ system when you're walking. How about your hands? How many times do we use those?
Yeah.
All the time. You're recharging your organ systems. Ears, I haven't quite figured that out. I think maybe it's like wind. Yeah. I'm not sure. I'm not sure on that one. But teeth, every time you put your teeth together to swallow, which is hundreds of times a day, you're literally recharging every organ system. You're giving it some more charge. So it's pretty dang cool. So the teeth that are connected to the endocrine system, which is the hormones, are the wisdom teeth.
And then everybody gets theirs taken out.
And oftentimes they don't heal properly. So now we have a short circuit in the endocrine system, showing up as thyroid problems, adrenal issues, hormone issues all across the gamut with fertility from men who have, I just found out a man I think he's like 35, his testosterone is like the lowest of lows, like an 85-year-old man should be. Why?
Yeah.
What's going on? Well, we go and look at those wisdom teeth sites and say, did they actually heal? Or is there still a dead zone? And we find these so frequently. So
it healed over and then there's a pocket that's been left and maybe a small like infection or something's in there?
Yes. So what happens is around each tooth, there's a ligament. And that ligament isn't just removed with the tooth. So it's kind of like the placenta and the baby. It has to come out separately. But when you're taking a wisdom tooth out on a 15-year-old, you're not really wanting to poke around much because they're way down by nerves and way up by sinuses. And so they don't get that ligament out frequently. The body doesn't know a tooth's gone for about 10 days. So in that 10 days time, think about like if you get a cut on your finger, how long does it take to heal? About 10 days.
Yeah.
So in that 10 days time, the gum grows over, everything fills up, but you still have this dead pocket in the jawbone where the bone hasn't grown in. So there's no blood flow to it, so it stays dead. There's no immune cells, so bugs can move in. More often than not, we find really high levels of inflammatory mediators. Basically, I like to think of these like the flares your body sends up saying, problem, 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 creating a ton of inflammation and shorting that circuit, which is the hormone circuit. I see so many young kids who, like they're in college and they say, yeah, I can't sleep, or I just have no energy. Literally, I sleep 12 hours a day and I still can't get to my classes on time. I don't know what's going on. I'll say, well, how long have you felt like this? Oh, since I was like a junior in high school. When did you get your wisdom teeth out? When I was a junior in high school.
Oftentimes do we really need them out?
It's all about Weston Price's stuff again. So if you look back 300 years ago, every person had plenty of room in their head.
Yeah.
But if the jaw doesn't grow adequately, there's not enough space for it. So I look, and my goal is to prevent anybody from needing wisdom teeth out.
Yeah.
So we try to jump ahead now of this growth train with all the kids and say, let's grow you adequately. So there's plenty of room for your teeth. So I'll look at teenagers. Some need them out. Some need, meaning there's just simply no room, and it's going to create a lot of issues in the future. So we get them out while they're teenagers or early 20s, because the jawbone hasn't hardened around them, the roots haven't formed fully. So if they're going to need to come out, that's the time to get them out. But we take extra steps. We remove the ligament, we do ozone, we put stem cells in that area so it initiates bone healing, all these kinds of things. So if you're really struggling with hormonal issues, fertility, adrenal, just all the fatigue, go get the scan. Go find out, did those wisdom teeth areas heal?
I know it's hard to know, but what percentage of dentists have this type of scan?
I would say it's probably maybe 10, 15%.
Yeah.
But oral surgeons, all of them have it. So 100% of those. Endodontists that do root canals, even though I'm not on that train anymore, but they all have these scans. So specialists, you're going to find pretty much 100%. General dentists, maybe 10, 20%.
So can you request it, get it, and then go back to your dentist and use it?
Absolutely.
I was watching one thing that you were talking about, and how someone had an abscess that then created a small hole in the jaw. And I was and to see it on the scan was amazing. You're never going to see that on an x-ray.
Nope.
And I was like, oh, that's incredible.
Yep. And the scary part is, I'll always remember the lady, she came and was just telling me her root canal just didn't feel normal. And I hear that. That's the most frequent thing I say.
Is it instinct?
Yeah. It's like it just, they just always kind of tap it and go, it just doesn't feel normal right here,
Yeah.
And so we took a regular dental x-ray, the kind that goes in your mouth, took a dental x-ray, and I said, it looks fine. And 10 out of 10 dentists would have said the same thing. It looks fine.
Yeah, it looks fine.
But I had just gotten this new CT machine, and I said, for the heck of it, let's just go take the scan.
Yeah.
Took the scan. She had a quarter-size hole in her jawbone that had gotten eaten away from this infection around this root canal. I couldn't see it. Yeah. Could not see it. And that was the day that I said, I will never see a new patient without doing a scan, because I can't help what I can't see.
Yeah. So a lot of times you'll hear, people have bad breath, the halitosis, something going on. If somebody has chronic bad breath, are there things that really can be a representation of?
Yep. Bad breath is often microbiome issues. So we talk a lot about microbiome with the gut.
Yeah.
What we don't talk about is that there's different rooms of the microbiome. There's the mouth room, the stomach room, the small intestine room, the large intestine room. They all need different bugs, and they're all there for a reason, and they all keep things pretty happy. So one of the common things people do is high alcohol containing mouthwashes like Listerine.
Oh.
And a lot of commercial toothpastes have something called triclosan in it. All of these are antimicrobials. So what they're doing is they're killing every bug in sight. Well, when you kill every bug in sight, the bad bugs flourish. So bad breath is often a bacterial issue. So what do? You have to not use an alcohol-containing mouthwash. So I have one that's colloidal silver, or just use salt water to rinse your mouth. If you want to do a rinse of some sort, oil pulling is also fabulous for this.
Yeah. I have a daughter that oil pulls, and Laird sprays colloidal silver in his mouth every night before he goes to bed.
Look at you guys. Yep. You're all on it.
Even when he goes in the ocean, he'll spray colloidal in his ears, nose, and throat, and then do it again when he comes back in. And we have the gel for wounds, but the spray has really been supportive.
Yeah.
The Sovereign Silver toothpaste. Now that, some people have caught up a little bit that fluoride is not maybe the best. And what state? Is it Utah that's taking the fluoride out, right?
2 now.
Wait,
Utah
did you?
was first.
Okay.
And I'm from Utah.
Yeah.
And Florida just happened this week.
Were you
Super
around,
exciting.
who brought that up? Why would they pass a bill and say, we don't need fluoride? Who thought of that?
I don't even know. I wish I knew. I wish I could take the credit for this, but I can't. But I can tell you that the ADA was not happy. The American Dental Association was not happy. And they contacted every single dentist in the state and said, go and petition your lobbyists. Go and tell them they should not do this, that you guys are going to have a massive just influx of decay, of cavities. This is an absolute wrong move. The governor signed it. So it is in action now. And this has been a really interesting thing to watch. So let's talk about what fluoride does. Why is this a good idea? And then why is there so much resistance to it on this other side? So fluoride was implemented in the early 1900s, 1920, 1930. They found that there were societies that had higher levels of fluoride naturally in their water. So they had well water. They had cavity-resistant teeth. They also had brown and white splotchy teeth. You know, nobody's talking about that because the high fluoride levels create a lot of cosmetic issues in the teeth. But they had high fluoride levels. They weren't getting cavities. So they said, this is awesome. Let's add fluoride to everything, and we're going to eradicate tooth decay.
Yeah, and which company made the fluoride, by the way? It's a byproduct of something else, isn't it?
It's a byproduct of industrial manufacturing. So it's a byproduct of pesticides, herbicides.
2 bangs for your buck.
Some other manufacturing. Exactly. We already have this junk sitting here. Why don't we add it to something?
Can we sell it?
Exactly. So they started adding it to everything. The problem is it doesn't just stay put.
Right.
And cavities are not a deficiency of fluoride. They're actually a deficiency of minerals. So it doesn't fix the problem that's really happening. So I always push back and say, did it work? Has anyone had a cavity since 1930?
Right, of course. Right.
So the goal was that it should just eradicate it, and it didn't work. Minerals are the key. Minerals are the key to cavities. So sure, it made stronger teeth, and it does, but it also decreases thyroid function. It also decreases IQ levels in children. This is a brand new study in January. It also decreases bone density. It does all of these other things. And for what? It didn't get rid of cavities. So let's just not use it anymore, please. And why are dentists so focused? And, you know, I'm on these groups where they say, oh my gosh, can you believe they're trying to get rid of fluoride? What idiot is doing this? I'm like,
well, it's also kind of like, how much time do people spend? They react to something, but then you go, okay, but did you look at the studies? Have you followed up since then? Have you read 17 more articles about all the things? So I always find that to be the interesting thing is you have these passionate beliefs, but what are they rooted in?
Exactly. And they're not doing the work to substantiate what they're claiming.
Yeah, the outrage
That's
on top
the
of
outrage.
it. It's like,
it's just so much fun to have the outrage. You know what I mean? This is so much fun to rage against the man or whatever it is. But are you doing your homework here? No, they're not, because anytime I push back at all, and it's just not that fun, honestly, to always be under the firing squads. Sometimes I'm just like, whatever. It'll go on in your ignorant, blissful life, you know, go on. But sometimes I push back, and it's always the people who think they know better until you start actually showing them research and documented research showing that hydroxyapatite, which is the mineral that teeth are made of, is just as effective as fluoride, or more so. It has no side effects whatsoever, and it prevents tooth decay as long as people are getting minerals, which is the real cause of it. When you start pushing back like that, they're just like, oh, you don't know what you're talking about, and then they leave.
Yeah.
Like, no, you don't know what you're talking about.
So when have they already taken it out in Utah, or when does it start?
Close. And it's been interesting to watch the news stories, because now the people that are running the municipal water supplies that are actually putting it in, they're saying, oh, what a big pain, because here we go. We had to create this entire system. They wear hazmat suits to add it to the water. Is that concerning at all to you? They wear hazmat suits. It cost them a lot to actually add fluoride to the water. And so they're a little frustrated that here they just spent all this money. They created all these systems. They got all these suits. And now we're saying, oh, don't put it in the water anymore.
Yeah,
it's been interesting to watch that. It's so inconvenient to do this.
Yeah.
So I think we're, 60 days, 90 days or something they have to clean this all up. So it'll be interesting to see, because dentists are sure that this is going to just mean a heck of a lot more work for them.
Oh, I see.
They're like, oh, this is great for us. You know, they jokingly tongue in cheek, oh, this is great for us. Thanks, everybody. Let's take fluoride out. Let's see how many more cavities you all have.
So we talk about mouthwash, toothpaste. You do see a little bit of that movement and people saying like, oh, you can mineralize your teeth. From your point of view, what do you tell your patients on toothpaste? What's the best kind? Which ingredients should they look for? What should they not?
Yep.
Because I know that gets kind of mucky and confusing.
It does. Hydroxyapatite is the key. And all that is the mineral that your teeth are made of. So when you smile, you're seeing hydroxyapatite. It's in crystalline form on the enamel of your teeth. So when you're getting a cavity, It's one of two things. Either acid has dissolved those minerals on your tooth, so from acid from your food or acid from bacteria. This is how bacteria create cavities. The sugar doesn't create a cavity. The bacteria eat the sugar, leave acid on your tooth, which then dissolves the minerals. So either something has pulled the minerals from the tooth or your body has pulled the minerals from the tooth, because this goes back to the girl that had 17 cavities. Her body needed a lot of minerals. She was still growing. This happens with pregnant women. They'll say, this root canal is for this baby. This crown was this baby. Because you're growing a human. You have a huge demand for minerals. Your body is very much an ecosystem, and it says, okay, I need minerals to run my brain, my heart, the things that keep me alive. I don't have enough to go around right now. So I'm going to pull them from mineral stores, which are your teeth and your bones. If you have cavities in your teeth, you also have holes in your bones. Oh. Pretty much straight up. Yeah. So you either have minerals being taken out from the surface from acid, or you have minerals taken out from the inside from your body's demands. So it's minerals that are missing. You've got to put minerals back. So if somebody is really working to remineralize their teeth, I do believe you can remineralize a cavity if it's in the surface layer, in the enamel layer. So as long as the cavity is surface layer in the enamel, we see it every single day in our practice. We say, remineralize this one. This one you're going to do. You do two things. Minerals from the outside, which is a hydroxyapatite tooth care product. So tooth powder, toothpaste, mouthwash. I have all three of those because I couldn't find what I wanted on the market. I'm not here to sell stuff, but you need something with hydroxyapatite in it. I'm going to talk about a controversy with that one. But the other thing is you need minerals on the inside. So that's specifically calcium, magnesium, phosphate. You need those things on the inside along with vitamin D3 and vitamin K2. That's Dr. Weston Price all the way. He figured out that you cannot absorb minerals unless you have vitamin D3 and K2. So that's your sunshine. That's, all these things that the kids aren't getting nowadays. That's the vitamin D3. You're not absorbing minerals. They're going straight through. So you have to get vitamins on the inside, minerals and vitamins on the inside, minerals on the outside. The big piece of controversy is what kind of hydroxyapatite. I don't know if you've seen this.
Yes.
The whole nano debate.
Right.
So let's just super clear it up. The enamel crystals, when the minerals are pulled out, it leaves a hole. That's what we need to plug. The hole's not very big. So you have to have a small enough particle that it will actually fit in the hole. Does that make sense? If you got a bigger particle in the hole, there's no getting in. There's no remineralizing. Yep. So people talk about hydroxyapatite from animal sources, from ground up cow bones, literally. It's too big. It can't get in. So you need a small enough particle. So we start getting into nano size. Nano just means really, really tiny. There was a study in Europe that showed that nanoparticles cross the blood-brain barrier. It was in cosmetic applications. So we're talking lotion, sunscreen, facial, moisturizer or makeup. But toothpaste is also included under the umbrella of cosmetic applications. So then they said you can't use nano in a toothpaste or a tooth powder. But here's the difference. When you're using it in the mouth, 90% of it spit out. We actually did our own research to find this. 90% of it spit out, 10% of it swallowed. Guess what happens to hydroxyapatite when it hits your stomach acid?
Yeah, it's because it's obliterated, I would imagine.
It dissolves into calcium, magnesium, phosphate, oxygen, hydrogen, into all those little things. So there is no such thing as hydroxyapatite past the stomach. Does that make sense?
Yep.
It's just minerals at that point. So when you're using it in an oral application, it doesn't matter. The only thing that matters is it's small enough to get into the tooth. So we use it's 200 nanometers in size. So it's still a nanometer. It's defined as micro sized, but it has to be small enough. And like 6 of our sizes will get into a tooth because they're small enough. But you get any bigger than that and they're not going to get into the tooth. It's not going to work. So that's what remineralization is all about, is you get a hole in the enamel and you plug it back up again. Now, it doesn't work when it gets deeper because the next layer in a tooth is called dentin, and it has more collagen, less minerals. It has all these tubes that go everywhere. And so once the bacteria are there, they're kind of riding in that superhighway throughout the tooth. So a dentist has to get involved once it's into the deeper layer of the tooth. But when you're in the enamel layer, all day long you can remineralize.
Is there a process that is like the most fun for you to do? Like, even if it's hard and it's probably not fun for the patient, but it's like a really great challenge for you. You're like, is there, I know keeping people healthy and avoiding health issues, improving that is probably obviously the most rewarding. But if you have to get in there, something technical, is there something fun?
Oh, I think it's always fun. Well, I used to love making smiles look gorgeous.
Yeah.
That was always one of my
Yeah.
very favorite things to do.
Well, imagine too, someone loses a tooth and you can build back their smile.
Mm-hmm. Yeah, because it's like a double layer of reward, where you see their confidence come back, but then you also know that they're healthier because of it. So it's like a double whammy with that one. So those are some of the things that I love the most. Or when somebody just completely, I love cleaning out these hidden infections at the end of old root canals or wisdom teeth, because they come back and they'll say the craziest things. Like, I had eczema for 10 years and tried everything. Literally a week after I got that root canal tooth out, my eczema was gone. Or my cholesterol was exponentially high. And 2 days after you cleaned out those wisdom tooth areas, it dropped by 90 points. I mean, those are the cool things when we see a huge impact.
If somebody has mercury fillings right now, they got to get them out, right?
That's what I recommend, but do not do it unless you do it safely. Because if you go to just any dentist that doesn't have all the precautions, it's worse than leaving them in.
Is there the name of the machine, or what is it called?
So there's an organization and they have what's called SMART protocol. So it stands for Safe Mercury Amalgam Removal Technique, but remember SMART.
Yeah.
SMART protocol. There's an entire directory. If you go to my website, livingwellwithdrmichelle.com, I actually have a directory of dentists that can do this, because that's my most common question. Where do I find a dentist like you? I'm like, go to my website. I've tried to recruit them all. I'm like actively recruiting right now. Yeah. So go to that directory, or the SMART protocol has a directory as well of dentists who've been trained to do that, because leave them in your mouth if you're not going to get it done right, because then you're just going to get more mercury in your body.
Right. So a lot of people, I think it's really natural, are motivated by beauty or attractiveness. And you mentioned, like even dark circles under the eyes, eczema, things like that. It sounds to me, everything's impacted, but it could be, your skin, your jawline, all these things can be impacted by your teeth.
Yep. 100%.
It's crazy.
100%. And it's really interesting what I found when I was doing cosmetic dentistry, especially, and when we do a lot of work with sleep and airway and things, is that usually the most beautiful appearance, or the naturally beautiful appearance, is also the healthiest. It's really fascinating to watch it. And it's like, okay, nature gets it. God gets it. Like we know how this works. Like the thing that works best looks best as well to us. Yeah. Really interesting.
I would love to, you must hear the stories all the time where you talk to the partner of somebody that maybe had some type of procedure and parts of their personality changed. That would be very interesting, because I think sometimes we think we're so fixed, but if our body is not in the right position to do all that it can do, you would think also that could impact, for example, the level of stress, or if you feel anxious, or if, maybe you have a quick temper, or I don't know, like these little things that it'd be amazing to, I'm sure partners say to you, after they had this done and this improved, these other certain things in their disposition changed.
That's exactly what I have now done with this new book. I was so overwhelmed when I was at my point of trying to get better, because we are not lacking in information today, right?
Well, and you had 4 kids.
Yeah. And everybody's telling you something different. This fixed me. This helped me. Try this. Do this. Do this. Oh my gosh. Where do you go first? What do you do first? And that was my point of just absolute, almost couldn't take a step forward because I didn't know which step to take forward. And so I took a step backward and I said, wait a minute. Are all the things I've been recommended, all the food, all the medicine, all the everything, it's all really just a Band-Aid, because our cells and body do the healing, right?
Yeah.
I always talk about if you cut your finger and you put a Band-Aid on it, the Band-Aid doesn't heal you. Your body does the work. It has to do the work. And it does it without you even telling it to do it, which is super cool. But our job then isn't what medicine, what Band-Aid to put on. It's what do my cells need to do the job they already know how to do. I believe we're divinely created and our bodies know how to do the work to keep well. So our job is to figure out, what do they need? Well, then that's another point of overwhelm. Well, great question. What do they need?
Yeah.
So I went back to all of the traditional medical societies, Ayurveda from India, Chinese traditional medicine, German herbalism, Kampo medicine from Japan. And I studied all of these. And I said, okay, what do they look at? What did they look at, when they determined how did they work with the earth and how do they make things better? Well, they looked at the symptoms in a different way. The symptoms weren't the problem. In today's modern medicine, if we get a headache, we can take an ibuprofen because the headache's the problem. But that's not true. The headache is your cell's sign trying to tell you that something's going on. So instead of covering it up like we do with modern medicine, we need to say, what does that mean? What cell is now trying to tell me something, trying to get my attention? So I actually took all of those methodologies and I created an assessment. I call it a symptoms assessment or a seasons assessment. So you plug in things like the things you just mentioned, moody, depressed, whatever. You plug in these not only physical symptoms, but emotional symptoms. You plug those all into this assessment and it tells you which cells need help first. Where do I start?
Yeah.
Because that's what we all need to know. Which step do I take first? Like, I'm willing. I want to get better. But where do I go? Which diet plan do I do? So it tells you which step do you take first. And then the whole rest of the book is, this is what you do if it tells you this. So the key is, what do your cells need to stay well? Because we don't have to get sick. We're not made to be sick. We're made to be well. Our bodies know how to do it.
Yeah.
We just have to give them what they need.
It's interesting. I am always intrigued by when people, for whatever the reasons are, that their health doesn't feel valuable. They sort of go, oh, well, I'll deal with that later. Or I know I should move or exercise, or I shouldn't eat that, or I shouldn't drink alcohol or whatever.
Yep.
And what do you do when you have a patient that, and sometimes when you're not feeling good, then that also is a veil to keeping you from being persistent
100%.
to getting in there. And it's like this chicken and egg thing where they can't get in front of the 8 ball because they don't have the wherewithal, the spirit to do it.
Yep.
So what do you do when you have a patient that you're like, man, it's going to be hard to get through to them? It's almost like that window of faith to say, hey, if you just follow me for a little bit and try these little things, you're going to see for yourself.
Yep.
How do you manage those types of patients?
That's the key, is it has to be small. And I also think it has to be very clear, because psychologically it's proven a confused person cannot make a decision. So, you felt it, I'm sure, if you've gone shopping for, let's say, a car, or, whatever it might be. And if you've been given so many options and then you sit there and you can't make a decision because there's just too much to choose from. So that to me is the most important thing as a healthcare practitioner, is I have to make the path very simple and very clear. There really can't be a lot of options. It's, I need you to do this tomorrow, and I need you to do it again the next day, and then the next day. Because what I find is that if you can help one cell be well, you can help every cell be well.
Yeah.
And you start to see incremental change, which creates incremental motivation. Because when you see something change, you go, oh, it was worth drinking that lemon water with a little bit of, cinnamon in it in the morning. That wasn't that hard. Okay, I could do that again tomorrow. I actually think maybe I feel a little bit better today. It's just the little tiny things. One step, one foot in front of the other. But the other thing as a healthcare practitioner is I've figured out I can't care more than they do.
Oh my gosh.
Because there's a lot of healthcare practitioners that really feel terrible because they can't fix everything and everybody. And I've had to realize that I can't care more than they do, but I can give them a clear path.
That reminds me of when I played college volleyball. I'm still very close to my coach. And one day we were in a game, we were getting killed and we weren't playing well, which happens.
Sure.
But our attitude was also bad. It's like, if you're playing good and your attitude's bad, okay. You're playing bad, but your attitude's good, okay. But both were happening. And she pulled us on the side and we had a timeout, and then we got in the huddle. You got like a minute. She never said a word.
Ooh.
And normally it's like, hey, serve number this and that, do this, hit this ball, whatever. And right before we went back out on the floor, she goes, I don't know what to tell you. I can't want to win more than you. And I thought, oh, I understand that. And I think you could say that even in parenting.
Absolutely.
Or in a relationship. It's like, hey, I want this for you. But at some point, this is going to have to feel like a real reason for you.
Yep. Has to be you who does the work.
Yeah. It's very interesting.
Yeah.
Tongue scraping. That's a whole, I love all these like trends on TikTok.
Yes.
It's like, is there value? I think you're a fan of copper maybe, or not. Like, how do you feel about that? Why would you do it? Do you need to do it? Only some people need to do it.
Yep. So tongue scraping is an old Ayurvedic thing from India. I actually have a very personal experience around tongue scraping. So I was in college, kissing a boy.
Not a girl.
No, not a girl, kissing a boy.
I mean, way to go.
And the boy told me that I didn't have very good breath.
Oh.
Uh-huh. Yeah. That's like, it hurts a little bit, doesn't it? Even like to hear that. It's like, ooh, and he knew I was going to be a dentist, and this was like a boy I cared about, and he was doing it out of the kindness of his heart. You know what I mean? And in retrospect, I'm grateful, but it didn't
you have
feel good
in your teeth
exactly.
or something. Are you going to be the one to say it?
Exactly. So it didn't feel very good at the time. Let's just say that it took me like maybe a couple of decades to get over it. But what I figure out is there was something going on with my biome, but I also had something called geographic tongue, which people struggle with this. It's kind of like bumps and ridges and things on your tongue, and you get, it hurts to eat pineapple and tomatoes and things that are acidic sometimes. And it's actually pretty common. Inside of dentistry, they call it idiopathic, which means we don't know the reason, which I just think idiopathic is a phenomenal word because it means we're all just a bunch of idiots, right? We just have kind of given up on the concept that we can fix this, that we can help take care of our bodies. So totally unrelated, I started tongue scraping. My geographic tongue went away and my bad breath went away. I wasn't doing it for that. I had no concept that it would fix it. I just was learning about things, and somebody said, you really ought to tongue scrape, and you're a dentist, you ought to figure this out. So I started tongue scraping, and first of all, it hurt like heck because my tongue was beat up because of this geographic tongue. Like it was always sore and rough, and it was literally bleeding when I first tongue scraped.
Whoa.
But I kept doing it because I'm like, no, I'm going to persist. I'm going to push through this thing. And all of a sudden, all of the weird stuff on my tongue went away, and the white coating on my tongue went away, and the bad breath went away. And what I figured out is I believe that the tongue is like a shag carpet, first of all. So it's going to harbor all kinds of things. I think it harbors yeasts. And those yeasts throw off the bacterial balance in the mouth and can lead to bad breath. They can also lead to geographic tongue and other issues. I believe they also lead to other gut issues and other problems. So I am an avid tongue scraper.
Even now?
Oh, yes.
Morning?
If I travel and I forget my tongue scraper, I have a little mini panic attack. So I have one in my travel bag that never leaves it now. Yeah, I actually do it at nighttime, but it really doesn't matter as long as you're doing it once a day. Yeah. I do it at nighttime because I like to get all the day's worth of stuff off. When I tongue scrape in the morning, there's less there. Doesn't mean you couldn't do it then. So the order of things that I do is I brush, I tongue scrape, I mouthwash, because I want the mouthwash to get into those tongue crevices. Basically, I don't want the crud on there when I'm mouthwashing, right? Because I want it to get into all the nooks and crannies. So what I found is that it's incredibly effective. If you have gum disease, if you have gut health issues, in fact, that's what Ayurveda says, is that it's for gut health too. If you have gut health issues, if you have bad breath, if you have geographic tongue, always tongue scrape. And do you have to use copper? No. Copper is antimicrobial, so it's not going to grow bugs on it. So that's why I like it, because you're going to scrape off bugs. And if you don't want them living and flourishing on there, then maybe use something that they can't grow on. So that's why I like copper.
Sometimes when I hear the word mouthwash, I think of the word skin toner. Like, do you really need it kind of thing? You think the right type, the non-alcohol based, is a nice little kind of rinse as a finish?
Yes, okay. I use it for a couple of reasons. My mouthwash has colloidal silver. So what it's going to do is it's going to help get the gums healthy. It's going to help balance the bugs. It has hydroxyapatite in it. So you're giving a second dose. You get in the toothpaste or powder, you get a second dose with a mouthwash. And I have diehard people who will not live without the mouthwash because they say it's the only thing that's reduced their sensitivity or taken their sensitivity away, because it gets into the nooks and crannies that your toothbrush doesn't. It gets underneath gums. It gets, places like that when you're swishing with it. So it helps with the sensitivity, hugely helps with the sensitivity. The other thing I've added to it are a bunch of herbals. So I have calendula and plantain and marshmallow root, which help with dry mouth. They help with inflammation in the gums, all of those kinds of things. So I see it as an additive. Do you have to have it? No. But if you're really wanting to stay up on your oral health or improve oral health, it's very, very good for that.
What are the non-negotiables for sort of baseline? I have a teenage boy, let's say. I'm making it up.
He's going to do one thing.
Or just, you know, they'll do two or whatever you say. You go, listen, these are the non-negotiables. What is that for dental care?
Brushing with hydroxyapatite.
Got it.
No question. And do whatever they'll use. So some people, I have a tooth powder. Actually, I have a toothpaste coming soon, very soon, like 3 weeks.
Do you think people like the paste more than the powder?
Yes.
They're just more used to it,
1,000%.
Yeah.
1,000%. I went with the tooth powder because I don't want to compromise. And I couldn't figure out how to make a paste without all of the things that were truly a compromise. There were a lot of things that are in commercial toothpastes that I don't like, that I don't want. Well, it's taken me about 3 years to figure out how to find alternatives to all of those things I didn't compromise on. So now I have a paste without compromise too.
Yeah, your formulators must love you.
It's actually me in my kitchen, literally.
Are you serious?
Literally. I do all of my formulating in my kitchen.
That's amazing. You have to.
Yeah.
I mean, I even know from doing food things that you say, hey, can we do it without this? And they go, oh, no.
Yeah.
There's no way.
Yeah. And they push back. They're like, no, we have to use this or we have to use this. I'm like, but I don't want to use that and I won't. Yeah. So I formulate it. I make it up in my own kitchen, my own batch. I use it myself on my own first test subject when it works for me, when it doesn't dry out in the tube, when it, all these things.
Your shelf stability.
Then I send it to the manufacturer and say, okay, now make this on a larger level. Yeah. But this is what it's going to be made of. Figure out how to do it.
That's amazing.
Yeah.
Tonsils. Mm-hmm. Everyone, it's was such a common thing. And, I always love when they go, oh, well, it has no use. And you said earlier, like, I do believe we are divinely created. Yep. The miracle that is what our body's able to do day in and day out. Yep. Where does tonsils play in your world?
Tonsils are the primary defense system of the lymphatics for the head and neck. So when you get rid of them, now all of a sudden, everything is going to have to go down lower to be fought. This is the first line of defense. So why would somebody be told they need to get tonsils out? It all goes back to what we talked about a while ago with the space in the back of that mouth. Because if you don't have a big enough mouth for your tongue to fit, for the tissue at the back of the throat, the soft palate, the uvula to fit, and the tonsils to fit, then you're going to snore. You're going to mouth breathe. We haven't talked about mouth breathing. You're going to mouth breathe because you mouth breathe when you can't get enough air in through here and down past all of that stuff. So then you drop your mouth open, which allows more air to come in.
Yeah, it's like 3 times, right? The amount of air or something.
Yes, but it's dry, it's unfiltered, it's unhumidified. Mm-hmm. It doesn't, when you breathe through your nose, what happens is you actually create nitric oxide, which expands your blood vessels.
Yeah, you can absorb more oxygen,
yep.
Right? Yeah.
The oxygen gets to your brain, gets to your muscles, gets to where it needs to go. So when you mouth breathe, now you got this dry, hot, unfiltered air hitting the tonsils. Guess what they do when they do that? They swell up.
Yeah.
So when people say, well, you've got swollen tonsils, we need to take them out. I say, you've got swollen tonsils. Why?
Yeah.
Is it because you're mouth breathing? So do we need to make your mouth bigger to make more space for all of that? Is it because you have some food allergies? We see this a lot, actually, especially in kiddos. Is it because you have food sensitivities? Do we need to address the food sensitivities? And then the tonsils go down because the tonsils are swollen because some invader is trying to get into you. It's the sign. Remember we talked about don't cover up the sign. Don't put duct tape over the dashboard. It's the sign. Instead of saying, take them out, we say, why? Why are they swollen? So we have all sorts of things we hit it with. We say, okay, do we need to make the mouth bigger? Do we need to work with food sensitivities? And then we actually use laser and ozone to shrink them back out of the way again. Yeah. So we can keep them there because they need them. We need them. They're there for a reason.
Yeah. Stress. So let's, someone eats well, they live well, they're outside, they're doing pretty good. Even maybe their gut's okay, but they are, they have a great deal. It's just their life, that period of time, the amount of stress. Where does that hit some of your patients? Is it the jaw and then that impacts the teeth? Do you see that a lot in your practice? Like pretty healthy people?
Yes and no, both. I always take a step back again and say, when you're stressed, what do you need more of? Oxygen.
Yeah.
And you get more oxygen by grinding and squeezing your teeth. So then it shows up as headaches, as sore muscles, as sore jaws, all of those kinds of things. So it all harkens back to the underlying, what are you not getting enough of?
Yeah.
You need more of it when you're stressed.
So and to quickly downregulate and get into your parasympathetic, and they never get that chance.
They never get that. They're always living up there in that fight or flight where everything's not working well anymore. Yeah. Everything's heightened. All the you got vasoconstriction going on, like nothing's flowing where it needs to go, and you just need more oxygen. So you clench teeth because you've got to get more oxygen. People say this like, well, I only do it when I'm working, or I only do it when I'm working out, or I'm only doing it when I'm stressed on the road. I'm like, there's a common denominator to all of those scenarios. Yeah. They all require more oxygen because your brain needs more when you're stressed. So it all goes back to oxygen. It really does.
It's kind of amazing. When you think about Weston Price, it's like how far ahead of his time he really was.
Mm-hmm. Yep. And he didn't put all these pieces together necessarily.
Right, but just even the observation.
Mm-hmm. Yep. And he was looking at societies that hadn't been touched by the modern world. Mm-hmm. Now, that's not us. So that's an interesting challenge because we have to take what he taught us and say, it's all true, but how do we utilize it today? So our food supply is compromised severely. Fruits and vegetables aren't what they used to be. Grains aren't what they used to be. What do we need to do to be able to handle them correctly so we still get the benefit of them in the world that we live in today? And really, that's one of my biggest things as well is how do you make living well possible today? Yeah. Because it shouldn't be overwhelming. It shouldn't be impossible. It's not. It is possible.
Well, you have a very practical approach. So you mentioned, you have 4 children. You went through all of these things. What have you learned? Because a lot of people are a lot of things at one time. You have a lot of different roles. You've had a lot of roles. How did you find the way to juggle that as a person? How were you able to spin those plates, especially during the times where I know it was very challenging?
Yeah. Part of it was necessity. You just do it because you have to. Yeah. You have to pay the bills and you have to feed the kids and all those kinds of things. I have been very blessed in my life to, even when I'm struggling, I'm able to get out of bed. And I feel very fortunate for that. I have one of my children really struggles with mental challenges, and I watch it and I think I'm really blessed to not have that struggle. So I've always just been able to get out of bed and make myself do it when I have to. But it's really about the cells. As soon as I figured out what I could do to make even a little bit of incremental progress, that kept propelling me forward to more. And this is my personal mission. My personal mission is to help people live well so that they can live their personal mission, so they can do what they're meant to do here on earth. And I figured out that as long as I stay there, and that's my motivator, and that's the reason that I get out of bed, I'm able to keep doing it.
Yeah. It's so interesting as a parent when you're hardwired really differently than one of your children. Mm-hmm. That's a tough learning. Yep. That's a very hard lesson because you don't actually understand. Nope. And then you're supposed to somehow parent or be there.
Yep. And the thing that is, I've just, even because now he's an adult, I can't predict his struggles. I can't predict his responses. I can't predict it because I don't live it. Yeah. And that's been really challenging too, because I don't always know the way he's going to feel or react or respond. And so sometimes it hits me out of the blue, you know, and I think, oh, wow.
Yeah. Do you ever
see that coming?
Do you ever lean on stuff? I mean, I can, like, for me, when people talk about surrendering, right? I thought, oh yeah, I didn't really understand what that word meant until I became a parent.
Yes, very much so. I have had to give up knowing it all.
Yeah.
I think that's the biggest thing I've had to give up. And I've had to give up being right. And I've had to, even if I might be right, I can't be right. And that's really hard.
Yeah.
Sometimes I just have to stop talking. Sometimes I just have to walk out of the room. Sometimes I just have to, and that's not my nature. And so I think that's why I've been given this challenge, because I've needed to learn patience and acceptance and grace. Yeah. Because I don't think I had a lot of it to begin with.
Yeah, I can relate to that.
It's hard.
Yeah. It's a great lesson.
I'm still learning.
So I think I was going to maybe ask you about inflammation, low grade, systematic, inflammation, and kind of if there's biomarkers or, things that people can track. If any of that has really shown up for you. Because, one thing I've really learned doing this, having all these conversations, besides sort of some real cornerstones of well-being is one of the things you want to avoid is chronic inflammation.
Yep.
Like, yeah, fine, inflammation's great, it's healthy, but it's the chronic that gets you. So is there anything that shows up in the mouth that maybe is an indication that is it in the gums? Where is it showing up?
Yes. And inflammation is aging. And that's really why we age, is because our body is inflamed. And inflammation is a natural process, right? It's our body's own thing it's doing. It's responding to stressors, it's responding to toxins, it's responding to whatever it might be that's hitting it. So inflammation is our body's own response to things. But chronic inflammation that never ends, that never lets up, that's what ages us, because our cells do not respond or rebound from that eventually over time. It builds up this accumulation, and that's aging. Yeah. That's what aging is. I've heard it called inflammaging, where basically like inflammation is just aging. So we will see it largely in the gums. If I look at somebody and their teeth are clean, I can tell they brush the teeth. And we as dentists can tell. I can tell if you only brushed your teeth last night, and you hadn't for the previous 3 months. It's pretty obvious. But, if I can see somebody's mouth and their teeth are clean, their mouth's clean, I can tell they take care of themselves, but yet their gums are bright red. I'm like, ooh, you are on fire right now. Yeah. Let's figure out what this is. Is this a failed root canal somewhere? Is this infection where that wisdom tooth came out? Is this gum disease that your body can't take care of because you have high blood sugar and now your body can't regulate things properly? I mean, there's just so much indicator that happens in the mouth. The gums are a huge dashboard of what's going on in the body. Yeah. So if oftentimes, and this is again where I think dentists shortcut ourselves, because we say you have red gums, bleeding gums, you have gum disease. So we're going to treat your gum disease. Well, we treat the gum disease by cleaning the teeth, but we don't treat the gum disease by treating the body, by treating the cells, by treating what's going on systemically or even sometimes in the mouth that leads to that. So chronic inflammation is the reason we age, is the reason we get sick. There are some things that you can check. In the mouth, obviously, we look for bleeding gums. It's a super easy dashboard. In the body, you can look for things like CRP, C-reactive protein, and some of the other inflammation markers that show up. Cholesterol is also an interesting inflammation marker.
I have super high cholesterol. I always have.
Okay, so this is fascinating. So,
like super high.
Cholesterol is, we need to check your root canal. Literally,
cholesterol was way high even before the root canal.
Yeah. Well, that's
because the root canal was like late 20s. The cholesterol was the first time I got my blood work, which was early 20s.
So cholesterol is your insulator. So if you have high cholesterol, it means your body is insulating itself from something. So this is the whole problem with statins, because they're reducing the cholesterol, which means they're reducing your protection. My mother-in-law has been on statins for 30 plus years. She now has dementia.
Well, the thing is too, people don't realize our brain, right, is made of cholesterol.
That's why she has dementia.
Love it. You get on the statin, and then all of a sudden
your brain is gone.
And your hormones, right, they're made from cholesterol.
Cholesterol is the precursor to make all of the hormones. So maybe you're just a super hormone maker and a super brainiac.
I don't
you just have a lot.
We know that's not true.
You just have a lot of cholesterol. Maybe so. I think it is true. But it would be good to say, what's your body protecting itself from?
Yeah.
Because again, that's what leads to more inflammation. The cholesterol is not the problem.
Yeah.
It's not the thing we want to kill. It's the thing we pay attention to, to say, why is it high? Rather than turning it off, going to figure out why it's high. What is it insulating you from?
Yeah. It's interesting. Okay, my last question. Teenage girl, menopausal woman. The teenage girl is having a hard time with her cycle, and maybe a woman she's going through it. And obviously you can get your hormones checked and do some stuff. Is there anything that shows up, I'm just curious, in the mouth that you're like, this person's either headed for this kind of discomfort, or you could ask them, hey, do you have a hard time? either forgetting things, because I know you even talk about brain fog, or period cramps or things like that.
Yep. Yeah, it's interesting because my daughter, 18, she's 18.
Do they listen to you though?
Do they listen to me?
Yeah, we joke an expert, somebody who lives a mile away.
Sometimes, but not always.
It's in there. It's getting in there. Don't worry.
Slowly, it's creeping in. Yeah, she's 18, and my husband and I were slightly terrified of her.
I have one of those.
Exactly. It's like, when she's home, we're all kind of just walking on our tiptoes and just afraid to say anything because anything we say might not be right today, And I was like, oh my gosh, like who knew we were so bad? Yeah. So that was really fascinating.
And annoying.
Oh my gosh, we're so annoying. We're embarrassing
annoying.
Too. We're really embarrassing.
Yeah.
So yes. So all of these things. So we actually went and had her hormones tested, all of this. Guess what they found? It was nutrient levels.
Oh.
It all goes back to nutrition because just like we said, cholesterol is the thing that's the precursor for hormone development. Cholesterol, actually good cholesterol comes from good food. Yeah. So it all came back to nutrients. She said, yes, you've got these hormone things. Actually, I didn't know this. I should have known this because I suffered from infertility for forever. So when your estrogen is high and your progesterone is low, it means that you didn't actually cycle. You didn't ovulate that month. And estrogen is your ornery hormone and progesterone is your happy hormone.
Yeah, it's cool. Let
exactly.
it go.
So this goes back to Weston Price, Dr. Weston Price. Everything apparently goes back to him today. He found that there were societies that nourished the young people who were in the age of reproduction. Mm-hmm. They gave them special diets. Like they would save the best food for them. Because what he figured out is the body will not ovulate if it knows it's not full of enough nutrients to support a fetus.
Right.
Does that make sense?
Yeah, they always say even that nutrition is the one as important as the first trimester of pregnancy.
It's the before the ovulation. Yeah. Otherwise you won't ovulate to begin with.
Right.
So when you don't ovulate, you have high estrogen and low progesterone. So you're super moody. So all of a sudden we looked at her and we said, well, first of all, I'm glad she doesn't need to be ovulating right now. That's just fine. She's 18 years old. Yeah. Totally fine with no ovulation, but not fine with the high estrogen super orneriness, right?
Yeah.
And neither was she. Like she asked me to go to the doctor. She's like, Mom, I am so ornery and I just can't stop it.
Yeah.
And so she's on with her friends and I'm her mom, I'm never going away, but her friends, they might. Yeah, so exactly right. So I want her ovulating just for the point of I want her to have progesterone to come and balance things out. So the same thing in menopausal. So it all comes down to nutrients. So we see this in the mouth. It's all the things I've talked about. You start getting cavities as teenage years because you're low in nutrients. You're low in minerals. So guess what? We might not get them from our food today because we have challenges.
Yeah.
We may just have to supplement. So pretty much I put every single teenager on vitamin D3 and K2. Weston Price called it Activator X because they had not named vitamin K2 yet, but it's vitamin K2 and minerals. You've got to have those things to be able to keep your body up to say, oh yeah, I'm okay. Actually, I can do this. My body is healthy enough to support another baby, to support another person. So I'm going to ovulate. I'm going to get it progesterone up to where it needs to be so I don't bite everybody's head off.
Yeah, so we can live with other people.
It all makes sense. Yeah, it all makes sense. It's all about nutrients. Isn't it crazy?
Yeah. What's funny is to look at you, one wouldn't necessarily think you were a rebel, but...
I look pretty clean cut.
I think you're like a secret rebel.
Secret rebel, exactly.
Yes. I think your dad must be very proud. Well, Dr. Michelle Jorgensen, thank you. And thank you for writing Living Well. And maybe just remind people all the places they can find you. And maybe they want to not only check out your information, but you do have a lot of great products that you've personally vetted.
Yep.
And maybe they can just reach out if they need anything.
Yep. Living Well with Dr. Michelle. It's a big mouthful, but it does rhyme. So that's helpful. And then the book is coming out May 20th. I don't know when this will come out, but May 20th.
Well, we'll coordinate it right around.
Awesome. So livingwellbook.com. And when you go there, what you're going to get is that season's assessment for free. You're going to be able to plug into the digital version of it. It's going to spit out right which cells to start with. And then you're going to get the first steps guide. Remember, it's just one step that you need to start with. So you're going to get all of that when you get the book at livingwellbook.com. But just go check out on social. Like if you're interested in any of these topics, I have so much stuff. I talk way too much. Yeah. So I have videos.
Isn't it
I have
a whole
everything.
new way? Isn't it crazy to you that it's the whole new way to be in your practice and do all this stuff?
Just to talk to people.
And share the information.
Yep.
Well, I really am so grateful. You make it very clear. And I always think it's more powerful, not only that you have your own health story, but the fact that you were trained sort of more traditionally and just looked at the landscape and said, well, wait, there might be more here. I find that those messengers are sort of the most powerful because they know all the sides.
We've lived it.
Yeah. And I really appreciate it. So thank you.
Thank you. Thanks so much for the opportunity.
Thanks, everyone. Thanks, everyone, for spending some time with me. Hopefully you got something out of it. If you did, feel free to share it with your friends. And don't forget to like and subscribe. And also, I want to hear from you. Tell me what's working, what's resonating with you, and how you're getting it done. Keep going.